I
Yeah,
am
good
Shaibu
evening.
Isifu, like he said earlier on, and then we'll be looking at data for decision making. The first question one will ask is that why is this topic even necessary? What is the motivation? But before I go to the motivation bit, let me take you through the presentation outline. They look plenty, but they are one slide each. So we'll just go through this one in the next 15 minutes. So I have some pictures here. One is the first one. You see the picture, the heart and then the brain. Now, some of us, we take decision not based on any data, but based on our own intuition. We listen to what our heart or our brain is telling us. So sometimes we are torn between the two, which way to go. Such decisions could be dangerous because it is not backed by any fact. Look at the second picture, the one down there. Somebody wants to take decision. The person has actually a magnifying lens trying to scrutinize every document or data available to him. Now, between these two people, the one listening to the heart and the brain and swaying as to where to go, and then the one having the magnifying lens, certainly you can tell which decision will be quality. Then the last one, in the era of infobesity, where you have a lot of information running across, or you have a lot of data, how do you actually take decision in the midst of this voluminous document? As you can see, my man down here with a lot of documents. So this voluminous document could be simplified or processed into just these two graphs you are seeing at the back there, so that decision making could be easier and could be appetizing to all who want to do so. Like I said earlier, what is the motivation? Now, let's ask ourselves these four questions. Why is it that some countries, in the last 20 years, about 10 countries have been able to eliminate malaria, and 10 have, they've gotten a malaria-free certificate. Algeria and Morocco, just closer to us here in Africa, are part of those who have been issued with a certificate. Just last year, China and Argentina joined the fray of people who have eliminated malaria. Why are we still lagging behind? Maternal mortality occurs, 99% of them occur in sub-Saharan Africa. Why is it so? In 2016, about 70% of people died out of NCDs. We're talking about the cardiovascular diseases, the, how do you call it, the cancers, diabetes, etc. Yet in Ghana here, less than 20% of our health budget goes into controlling NCD, whilst 70% are being killed annually by the NCDs. Why is it that Africa, which has just less than 11% of the world's population, or around 11%, contributes about 24% to the global burden of diseases? These are the things we should be thinking about when it comes to data. We will find the answers as we go through them. Now you're talking about data. What is data? So we are saying that data is just a raw or unprocessed information. So when you have the information you have gathered, just the raw facts, you've not added anything to them, you've not processed them. You say you have what? Data. So it could be a number of students in class, a number of people even suffering from malaria. They could be just raw. Once you have not processed it to make any meaningful deduction in context, it's still a data. Just that we use them interchangeably. Sometimes information is used interchangeably with data, but we should know that a data is the raw fact, while the information is the processed what? Data. Now, what do we use the data for, or the information for? We use them to make decisions. In this case, so far as data is concerned, you can look at a decision from two angles. Either it's evidence-based decision making. That is when the decision you are making is supported by the data, or you are making the decision as a result of the data that you have. Then we have what I described earlier when I used the brain and then the heart. That is intuitive decision making. That is when you just get up out of your own feelings or your experience, you make decisions. But those decisions usually are not supported by data. It is through your feelings. If you have one person in your household suffering from malaria or dying from malaria, then you see malaria to be the most monstrous disease in the world. But if even we have COVID-19 and everybody is dying and your household is not affected, you might see it to be mild. That is intuitive because you're not even looking at the data whilst making these decisions. We have two types of data. It could be qualitative or quantitative. Now, the quantitative take a numerical shape. So when you are quantifying the data, putting numbers to them, then we say you are having a quantitative data. But when you are describing, you are putting them in a words form. You are describing a characteristic of something or a quality, then it becomes a qualitative. So qualitative takes on not only the numbers, or it doesn't even talk about the numbers, but it talks about words, characteristics, qualities. Then now the question one will ask is that which of them is appropriate? None is appropriate. The two combined is good. So it is easier for you to say that 30% of children under 5 die out of malaria, but you have said nothing. That is quantitative. Once you say 30% die out of malaria, that is okay. But what is making them die out of malaria, the how and then the why, is the qualitative. So for somebody to understand 30% of children under 5 die out of malaria, you should put a description to it. Why are they dying? What is causing it? And that becomes the qualitative aspect of it. So putting the two together gives a complete picture of the situation, and people who actually follow and make meaning out of it. Let's look at this attribute. We are saying that what are the characteristics? What should go into data? Now we have, I'll just brush through this because it's in the model, you've done it. But validity. Validity is you being able to measure what you want to measure. Now, if I set out to come and do presentation and I'm able to do the presentation, it means I'm valid. So the validity is what you set out to do, and being able to do it becomes valid. Reliability, being able to reproduce. So if I say I use X, Y, Z and I arrived at A, B, C, somebody using the same X, Y, Z should be able to arrive at a similar result elsewhere. And that is reliability. You have been able to reproduce using the same steps and the same methodology. So that is reliability. These two things are very key: validity and reliability. Then completeness. You shouldn't leave potholes in the data you want to collect. If you want to collect data about malaria, it should be comprehensive. You should look at all aspects. There shouldn't be key aspects shouldn't be left out. Then timeliness is talking about currency. How current is your information? And when we need the data, do we get it on time? If you bring the data at the time decision has been made, it is not timely. It is of no use. Then the integrity. To what extent are you influencing? Are you massaging the figures? We have been seeing that health workers usually massage figures. So when you do that, it means that your data has no integrity. Then confidentiality, that is ethical use of data. Whom are you disclosing the information to, and under what circumstances? So we don't have to just disclose information to people because they are sensitive informations. Then the purpose of data. So when you take the data, how do we use the data for, or why do we even take the data? To make a program management decision. You are having a project, you're having a program, you want to make decision on them. You want to see how they are going. Data is very important. You want to keep track. How are we faring? Data is very, very important. You want to provide evidence to improve the program. So the evidence lies in the data. Whether the data, whatever you are seeing, cannot be said to be an evidence-based, as we saw in the evidence-based decision making. Then to demonstrate a program's progress and achievement. Now, quickly, let me talk about how do we use we are talking about decision making, but before you are able to make the decision using the data, then it should be done in the context of monitoring and evaluation. Now, monitoring simply is you tracking your program at every step of the project. So if I have a program or a project, and every step of it, I take data to track it, then I'm doing monitoring. Evaluation, however, is you measuring your outcome with your objective. So I set that the objective of the program is to do X, Y, Z. Have I been able to achieve that objective? So you looking at your achievement vis-a-vis your objective is evaluation. Evaluation is either done at the beginning or the end of the program to look at the impact. Whilst monitoring is recurring or cyclical at all the steps of the project, evaluation is either done at the beginning or at the end. Monitoring is looking at the efficiency. What we are doing, is it cost effective? How are we managing the resources? Evaluation is looking at how effective is the intervention. If we said we wanted to reduce malaria by giving mosquito net, ITN, is the reduction in malaria you are seeing attributable to the mosquito net distribution? It is not enough that you have given out a net and people are not having malaria. But the question you have to ask yourself is that, is the reduction attributable to that intervention? We are also saying that the monitoring will alert management of discrepancies whilst you are implementing, and the evaluation inconsistencies between program and objective. I've already explained that. So that is what we need to know. Whilst evaluation is measuring your outcome or measuring the impact of your program vis-a-vis the objective, and then the monitoring is almost a routine thing that we do. Now we have the monitoring evaluation pipeline. Now what we are saying is that we have what we call the IPO system, or the monitoring evaluation pipeline. It has our 5 input. We have the input, process, output, outcome, and impact. Now, at the monitoring level, what we seek to assess is the input, the process, and then the output. The input, what are you investing? Then the output, what activities are you doing with the inputs or with the money, the resources you have invested? And the output, what are the immediate outcomes? So the input could be the human resource, it could be money. The process could be training. You are training people with the money. Okay, then we have the output. So how many number of people have been trained? That is the immediate outcome of the activities. Then the outcome and then the impact is looked at the evaluation level. So now, what is the impact or the outcome? They are the long-term process. So what is the impact of the ITN distribution? Like I said earlier on, I've given out ITN, but what is the impact it is making on the population? Is it reducing mortality due to malaria? Is it actually bringing down the number of children suffering from malaria? So these are the impacts. And that one cannot be done through monitoring. It can be done through what? Evaluation, where a team of experts have to put in a design and go out there to see that actually the reduction is as a result of your intervention. Then we have indicators. You cannot do monitoring evaluation without indicators. What are indicators? We say the variables that measures changes directly or indirectly. So you are setting out to go and do monitoring. How will you do the monitoring? You need to have what we call indicators. The indicators, example of an indicator is, what is the proportion of resource, the money used, proportion of children sleeping under ITN, number of household having ITN. These are called indicators. So when you take your data, these are the things you are going to measure. Now, indicators can be calculated in 4 forms, as you can see on the slide: count, ratio, and proportion and rate. What are count? Count are just you having, like we say, you're just counting the numbers like the name goes. It doesn't have any denominator. Now, what is ratio? Ratio is a fraction where the denominator is not part of the numerator. So I'm doing the ratio of males to female. So if the female is the denominator, the males cannot be found in the female. So you say it's a fraction where the denominator is not part of the numerator. They are independent. Let's say the ratio of blue balls to red balls. You realize that once you are doing that, the red balls cannot be said to be in the blue balls, and the blue balls cannot be said to be in the red ball. They are mutually exclusive. Then proportion. Proportion is also a fraction, but with that fraction, the denominator is part of the numerator. So you are saying that what is the percentage of females in the class? That could be the number of females over the total number of people in the class, which includes the females. So the numerator is part of what? The denominator. Then the rate. The rate is the same as the proportion, but the rate is looking at it within a specific a specified period of time. So you see the number of children dying from malaria in 2016. Once you bring the time element, it moves from proportion to rate. So rate and proportion are the same, but the rate has a time element. If you are looking at the thing within a specified time, then it becomes a rate. Now we say that the proportion could be 100 in percentage term, it could be in 1,000, it could be what? In even millions. Like we are seeing, we said that the people dying from COVID-19, let's say the COVID-19 mortality is 1 over what? 1,000 or 10,000 population. Once you bring that, then you are talking about proportion. But if you bring the number of people who died from COVID-19 in, let's say, March, and you say that the rate is 10 per 1,000 population in March, then you are making it a rate. So once you bring the time element, and I believe you get it, because of the time, you cannot elaborate much on it. Then we say indicator rates. Now, it's a cliche. When you hear that indicator rate, that is the characteristic of an ideal indicator. The R stands for, it should be what? Reliable. We've already said that. Then the A stands for appropriateness. The V stands for validity. The E stands for easy. And then the S stands for what? Sensitivity. So when we say indicator rates, it's an acronym that stands for reliability, appropriateness, validity, easy, and then sensitivity. Then why do we even conduct MAE at all? Now we have 3 main reasons why we conduct MAE. And one for program improvement. You want to improve on your program. Once you have the data, you know where you are going wrong. You know you are not being efficient. Then you decide to improve upon it. Knowledge development. The information you gather out there can contribute to knowledge sharing and knowledge development. There are certain things you didn't even know, certain side effects. The data will show that to you. Then we have the judgment and accountability. Once you have the data, you hold yourself accountable, and other partners can also hold you accountable for the resources they are giving to you. So these are the reason, or the cardinal reason, we embark on monitoring and evaluation. So, yes, I'm going to the summary of it. The summary of the whole thing is that in Africa and the developing countries, research has proven that decisions are making or policy are made through the political lenses. So our decision making is highly political. It doesn't give a hoot to the data. So we don't actually regard data when we are making decisions. Once the politicians are in charge, they do what they want. We don't have a system to collect data. So you realize that somebody will collect the data, put it in the office, the data will be there gathering dust. There is no robust system to transmit these data to the other agencies responsible for making decisions. Then we have fragmented agencies. Everybody is taking the data. So you realize that if it's about malaria, whilst Ghana Health Service is taking data on IT and other things, the environmental health people might be taking data on the bushy environment and stagnant water. These data are not synchronized. So these people have this data, these people have this data, and then they are speaking from different hymn books. They don't synchronize to take a holistic decision. We learned about the system thinking approach. We do not have that when it comes to the data collection. Everybody is doing what he wants. Then we have the poor monitoring and evaluation. We don't monitor, we don't take data frequently to see how the project is doing. We just use our intuition, our instinct to make decision. So that is also one thing that is affecting us. And this goes to answer the question I posed earlier on. Why others are able to eliminate malaria, we are unable to do that. Why 99% of maternal death is occurring in the developing countries. This answers those questions. And then the poor data quality. You might have the data, but the data is not quality. It doesn't respect the integrity rule. It doesn't respect the confidentiality. It does not respect the precision and all the other attributes that we mentioned. Once you have a data that does not respect those attributes, then those data are not quality as we expect it to be. Now, in conclusion, I've taken some quotes from 3 important people. Data is precious thing and will last longer than the system themselves. Without data, you are blind and deaf in the middle of a freeway. Torture the data and it will confess anything. Let us all develop the habit of what? Evidence-based decision making for a robust health system. So, ladies and gentlemen, that is the ABC of data for decision making as I've tried to put together. And thank you so much for your rapt attention. I'm most grateful to you all.
Thank you very much, Mr. Shaibu Itifu. We are very grateful for your presentation.
That was awesome. That was awesome.
Yes. Young prof indeed. Someone asked a question. Can you throw more light on the difference between ratio and proportion?
Oh, okay. So yes, the ratio, like I said, both of them are fraction, but the difference is that the numerator in proportion, the numerator is part of the denominator. Example, the percentage of people in the site who have joined this program. Once we say that the percentage of people in the site, as in the program you are doing, who have joined this Zoom meeting, it is the number of people here over the total number of people who have enrolled on the program. So realize that the number of people here are still part of the total number. You understand? So you just take part of the total population to be the numerator. But when it comes to ratio, the denominator is not part of the numerator. They are different figures altogether. So you are talking about the ratio of boys to girls. You realize that boys will be a different number, girls will be a different number. You cannot find boys in girls and you cannot find girls in boys. So when the two numbers are totally different, then we say it's a ratio. But whilst the numerator is part of the denominator, then it becomes a proportion. That's the simplest difference I can give. I don't know whether the person is convinced or want more.
All right. Thank you very much. That was a great one. We are grateful. So those who couldn't join, who came in late, Dr. Scarlett, Tabot, and Nangi was the first to present. She presented on influencing without authority.